Good evening, ladies and gentlemen. Let me warmly welcome you to the knowledge sharing session conducted by the Sri Lanka Society of Transport and Logistics on the topic, Why Doesn't Road Safety Improve in Sri Lanka? Today's session is conducted by Professor Amal Kumarage. As many of you know, I don't think he needs an introduction. However, let me just give you a very brief introduction of Professor Kumarage. Professor Amal Kumarage is Professor Emeritus, Department of Transport and Logistics Engineering, Faculty of Engineering, University of Moratuwa. He is a transport sector professional with over 35 years of experience in academia, government, and consulting. As an academic and researcher, he has set up several academic programs and a department of study at the University of Moratuwa. He is currently engaged in promoting public transport, sustainable urban development, and safe travel. He has published extensively in transport planning, public transport, traffic engineering, road safety, transport project appraisal, and urban transport. Before we hand over the controls to Professor Kumarage, I would like to invite Dr. Vasantha Wickramasinghe, Vice President Events of Sri Lanka Society of Transport and Logistics, to give you a brief introduction of today's event. I wish you a productive event. Thank you.
Okay, thank you, Maris. Good evening to everybody. As you all know, so we are about to start our knowledge sharing session. Just to give a brief introduction to the session. So let me try to introduce like this way. Like recent months have seen a series of tragic road accidents across Sri Lanka, from the Cosmale bus crash in May that killed like 21 passengers to Ellawella tragedy in September that claimed 15 lives, and the Narambala collision in October that left several more deaths. Despite years of awareness campaigns, improved vehicles, and strict laws, road safety in Sri Lanka shows little progress, and the reason remains unclear and almost mysterious. The sessions aim to explore why our roads remain unsafe and how we can scientifically identify lasting solutions through evidence, research, and global practices. So today we are privileged to have Professor Amal Kumarage with us to share his expert knowledge, and he will guide us through a fresh perspective on why our roads remain unsafe and what we can truly be done to change that. So with that, I will give the with that, I will invite Professor Amal Kumarage take on the sessions from here on. Thank you.
Good evening, everybody. It's good to talk about a subject that has been close to my heart and I believe of interest to most of you. And when this session was advertised, several people sent messages to me asking me to speak about different areas of safety. Some wanted more attention given on pedestrians. Some were concerned about the reckless bus drivers, and so on and so forth. But I might disappoint most of them because I'm not going to talk about any technical aspect of road safety. I believe previously we have covered many sessions, seminars on those. Today, I want to step back and look at why over the years, in spite of many well-meaning efforts, road safety in Sri Lanka isn't really improving. So let me start with a graph that and here I have plotted the number of road crash fatalities over the last, well, nearly 50 years. And unfortunately, it is continuing to increase. We have had a few down, but as you can see, those have not been sustained. Now, I would like to share with you some opening thoughts that will set the direction for my session today. And I want to read this out to you, so please bear with me. Road accidents are not inevitable. They are preventable. Each society can make that happen if they want to. Road crashes are rarely the fault of a single human being. It is, in fact, the collective society failing the individual victim. Crashes are often the combined result of poor transport policies and short-sighted development programs. The lack of priority in public financing and the failure to hold relevant agencies accountable. Symptoms of countries' low social value on road safety and lives lost. Now, reflecting on Sri Lanka, when we look back over the years, and here I have tabulated some significant initiatives, programs aimed at reducing road accidents. We had in 2010, the UN Decade of Action for Road Safety, a global program. And then there were some initiatives, strategic plans that followed. In 2013, the National Council for Road Safety was formalized. Several gazettes and acts pertaining to driver licensing, vehicle safety, and so on and so forth. Then in 2020, once the UN decade ended, the National Road Safety Action Plan was formed for 2020 to 30. And particularly UN agencies, including WHO and the World Bank, have been consistently following up with various projects, programs, and proposals to work on improving this. And even under the current government, a road safety plan is a subject under Clean Sri Lanka. So where are we going wrong? There has been no shortage of initiatives over the last 15 years. In fact, there have been also certain actions that have been implemented, which I believe would have contributed in some way to reducing the accidents that would have otherwise happened. 2011, the making seatbelts mandatory. In 2016, the launch of SUASARIA, the 1990 emergency response system, ambulance service. And then 2017 to 29, a series of legislative enforcements under the Motor Traffic Act that introduced a lot of penalties and rules that were implemented. So even though more activities or actions may have been warranted in order to curb the increasing trend, it is not that Sri Lanka has been completely indifferent to that trend, and certain activities have happened. But still, why are we not able to change this trajectory? So as you can see, I have here plotted a slightly different graph, even though it looks the same. That is the fatality rate measured in terms of number of road crash fatalities divided by 100,000 people. So you can see over the last nearly 50 years, that rate has steadily increased. And we might say, yes, has it come down from 2019 or so? Well, the primary reason why it has come down is because of COVID, followed by the economic issues, the ban on importation of vehicles, and so on and so forth. And in fact, this year, judging by the numbers that are reported by the police, we might actually go back to about 12 fatalities or even 13 fatalities per 100,000 people. So we are back to the curve that we have had to live with. So sadly, the current probability of human death being due to a road accident is about 1 in 35, at most 1 in 40 in Sri Lanka. That means that every 40 funerals is due to a road accident. And that's not a very comforting thought. But I have been thinking, why have we seen these reductions, not simply 1 year, but trends that we have not been able to sustain? And I think this may be an area for some of you researchers to look at what may have caused those reductions over these recent years and why we have not been able to sustain them. Is it because other measures that are needed were not implemented? To my mind, some of the possible causes would have been in 2007, the scheduling of long distance buses that were responsible for many deaths at that time, reduction to some extent in their competitiveness, followed in 2011 by mandating the seat belts, and maybe even suicide starting in 2016. But clearly, even though these have contributed, they have not been enough. So a lot more initiatives like that may have to be taken over the years. Now, if we actually look at Sri Lankans' attitude towards road safety, I believe that is very unclear. What is clear, of course, it's very emotional based. Whenever there's an accident, you can see people are highly emotional. That is the talk of the town. There were times, some of you may recall, even vehicles were burned, drivers assaulted, and so on and so forth. Thankfully, that doesn't seem to happen now. But nevertheless, there is a surge of emotions around such an event. However, after the media dies down, and when somebody is made responsible, we seem to let our guard down and then relax. And obviously, we wait for the next accident and the cycle carries on. The second issue is that we seem to be very satisfied to find those who are responsible only under the Motor Traffic Act, which primarily, well, essentially, holds the driver responsible. And in most accidents, we find the driver to be responsible because finally he's the guy who went too fast or didn't brake or whatever. And drivers are often responsible to some extent. In fact, even in aviation, in the early years of aviation, all the accidents were attributed to pilot error, as it was called. But now things are different. Pilot error is still there. In fact, now they have two pilots, one flying, one monitoring. have been responsible for that accident. So we don't seem to want to go beyond the driver. We are happy to punish somebody, and often it is a hapless driver who is found guilty there. We haven't actually, I don't think Sri Lanka has had any single event where any public officer, a road engineer, an officer of the RMV who may have issued a driving license without proper testing, a driver training school, or anybody like that has been even asked to give explanation for their contributions. I don't believe we have even had a single penalization or a prosecution. We also seem to have our preconceived ideas about the bad drivers on our roads. And we almost seem to say, they are the bad drivers. When a bus goes down, obviously, 10, 20 people might get killed. But then, every day cars go down and meet with accidents that, more than that number get killed. We believe that car drivers are better, but actually when you analyze statistics, we find that all drivers in Sri Lanka are equally at fault. Some may be a little more than others. We also, from the government side, the typical reaction is we need to tighten the laws, as if we don't have enough laws already. And with that, we say that more laws, more discipline, we will have better road safety. But as I mentioned, we seem to be actually updating the rules, but still that doesn't seem to have helped us. So how can we change this? We can go on and on about the poor safety record in Sri Lanka. But let's stop there for a moment and see how we can turn this around. And obviously, there is no one single thing that can be done. But I would like to propose a different way of tackling this issue, which I call, or like to call, the paradigm of shared responsibility. And here I want to propose that safety should be a social responsibility that cuts across all of society. And I have here shown three primary stakeholders who need to provide the leadership in bringing about that responsibility. The first is the government in providing the leadership to create social value for road safety. And I want to talk about policy and financing under that two areas that government should be held responsible to bring the country to a footing where the whole country is actually working towards greater safety on roads. That leadership has worked in many countries, as I will show. And without that, we won't be able to generate enthusiasm, commitment from the rest of the nation to do what is necessary. The second and very important group of stakeholders that is needed are the professionals who need to be in the forefront of taking this message to society in their own different professional areas. The medical experts, the engineers, the educators, the lawyers, and so on and so forth, because this is a sector that requires multidisciplinary interventions. The doctors alone can't do that. The engineers alone can't do that. The lawyers alone can't do that. And we will talk about three areas: about education and awareness, about creating, designing safe systems, and also in building competency in agencies to actually deliver safety to the people. The third area are the agencies or administrators who need to actually deliver safety to the people. And here I want to talk about 4 areas: safe infrastructure for all, integrated data systems, effective user training and enforcement, and post-crash care, mostly the medical side. So let me quickly take you through these. But before that, I want to talk about not only responsibility, but accountability. We need to create a sense of accountability. Right now, as I was mentioning earlier, we seem to be happy to make the road user, specifically a driver, responsible for that. But we need to turn that around to make all these different people accountable to all road users, to give them the highest level or at least the minimum level of safety that Sri Lankans deserve. And I think that is a change that we need society to have, a paradigm change in the way we look at road safety. So what is the government responsibility? Sometimes government wants to do many things, but the 2 critical things which other people cannot do, other stakeholders cannot do, and which in fact government must do, is first provide leadership in creating social value. Governments must lead in creating a national drive to improve road safety. It is like dealing with a war. In fact, if you count the number of deaths that have been recorded in those 47 years and compare that to all the deaths that are officially recorded due to civil strife and terrorist activities, the numbers are not far different. So we have a war that has not ended. We have a war for which we don't even have a plan, a strategy to end. And there is no ceasefire that we can talk about. And we need to work towards reversing these trends and bringing it down to zero. So we need somebody like the war was ended and like such national issues are dealt with, somebody from the highest level of government to formulate this as a vision for a government, to highlight road safety as a core social value. We need to create, or the government needs to create policies that set out objectives that a government during its tenure will achieve. We need government to be open to learn from other countries that have successfully carried out such programs rather than coming up with ideas of themselves. Road safety is a problem that faces every country, and each country has either dealt with it successfully or have ignored it. And we can choose whichever way we want to do. And finally, we need champions from within government to lead this. And these are some of the people you will find if you browse the internet, whose names have now been established. Presidents, prime ministers, ministers, mayors from across the world who have been identified as road safety champions. And their work is lasting. Their work has saved thousands of lives, I believe. And we still need to find some faces for Sri Lanka, for Colombo, Western Province. Can we ask our president, prime minister, the minister, the mayor, to join in this rank and to bring Sri Lanka to the world stage in terms of political leaders who have led and become champions of road safety. The second area is to provide adequate budget. All these countries that have gone forward in terms of reducing fatalities have, together with the vision, made significant investments to back their intentions. 2 years ago, I was invited to serve on the Public Expenditure Review Committee appointed by the Cabinet of Ministers. And we had to deal with the Treasury, and we were looking at the expenditure of the Transport Ministry on safety. And we found that the road sector in particular, which was getting about 250 billion rupees in allocation, was spending something like 200 to 500 million rupees only for safety. That is about 1 in 1,000, 0.1%. The global standard is 10%. So we are spending 1/100th of what is deemed global standard for road safety. And they say it should be either 0.1% of the GDP or 10% of your allocation. So either way, you get about 25 to 30 billion rupees that should be allocated. We have never, ever allocated that money. So if government continues to spend like that, no minister should ever blame drivers or anybody else, because government has not done their part in allocating the required resources for safer roads, for better enforcement, for better testing, trialing, and management of road vehicles. In fact, it is not only government. Many governments have championed even private sector and even road users to contribute towards road safety. For example, many countries have suggested, and in fact, I myself have suggested some time ago, to charge 1 rupee per liter of fuel for a road safety fund. Of course, we have, I think, 1% of the third-party insurance of our vehicles goes to the National Council for Road Safety. If you didn't know, that is happening. Every year, about 60 million rupees is given there. They spend on a few things like hit and run accidents. But I was horrified to find that all the unspent money is happily invested in treasury bills. And now, or at least in 2022, according to the annual report, they had over 300 million rupees in treasury bills of our money allocated for safety, sitting there with so many accidents happening. Shouldn't we hold these agencies responsible? Their officers responsible, their boards responsible? I was reading that in Vietnam, 30 to 50% of the fines that the police levy are credited to the road safety fund. Other countries' private sector contributes to this safety fund. Some countries insist that if there is a capital expenditure project, say funded by a donor agency, 10% of that must go for safety-related expenditure. Now, these are things that we can easily do. We don't. So we need to hold government to do what government needs to do. And we need to stop this trend of government blaming a poor bus driver or a depot or a bus company saying you are responsible. They are responsible. But when governments are spending 100 of what they should to maintain road safety, their government is the primary accused in that case. So this is a snapshot of what other governments are doing. Sweden is a global leader, and you can see the policy and the vision. Australia, Japan, I have picked up as global leaders who have shown the way over the last 20, 30 years. And in each of these countries, it's not only the policy and the vision, they have set up an accountability structure. In Japan, the safety plan is coordinated by the Prime Minister. Okay, coordinated, held accountable parliaments, state assemblies, right, are held accountable when they don't reach the safety standards that they are pledged to. And you can see about the budget, how they match those global benchmarks. And then, of course, you can see the results. Sri Lanka, we have about 12 deaths per 100,000 people. Sweden leads the way with 2.2. So even if we can achieve Australian standards, we are saving about 2,000 lives per year. In 5 years, that's 10,000 lives. So this is an area where we need to press government to be more responsible. Now I come to a more difficult area, responsibility of professionals, where I need to put myself in there, and probably many of you in the audience being professionals or students learning to become professionals. Now, one of the things that I believe professionals should take as their responsibility is to inculcate a safety culture in Sri Lanka, develop a culture of road safety, which goes beyond keeping to traffic rules. For example, when somebody learns to drive, the first thing that is, the only thing actually that gets sort of, given attention is the road rules. You follow the road rules, you get your driving license. You're tested also on the road rules. And that is the one thing that they don't obey also. The safety consideration of a learner driver is never talked about. To look at driving from a safe perspective rather than a rule perspective. To know that when you sit behind the wheel, the first thing that you must come, am I safe? Am I fit enough to drive? Is my vehicle in safe order? Is my speed always safe? There are many places, even if the speed limit is 50 kilometers an hour, it's not safe to drive more than 40 because of what's happening in the road. And there are places where actually the speed limit may say 50, but it's safe to drive 60. And we know that is where the police will be, because they want to apply the rule rather than check the safety. So I think Sri Lanka has done this with respect to many epidemics that we have faced. And I believe the medical profession has inculcated certain health parameters into our thinking. I think dengue is one of the things I think we have successfully, well, not eradicated. I believe some years, I checked the statistics, we have lost 300, 400 people a year. And last year, 24 deaths. And we know society is on a dengue footing. We have people come and check our houses, right? And, we have now sort of adjusted lifestyles and what we do to adjust to that. How? They applied epidemiological parameters to contain that, like they did COVID, like they did malaria, like they did typhoid, and various things this country faced from time to time. And that is why the WHO is very interested, because they can apply those scientific processes to this. Just like the doctors, I believe the engineers need to come out with their own interpretations of safety. We need to have interpretation of safety. And this is where I think all different professional groups need to actually start talking about this, not only when there's an accident, like the media interviews us, but between accidents. It must end up in constant dissemination, not only as a subject in curriculum, but as a matter of community discussion and training. The second responsibility of professionals is to create safe systems. Now, in transport and logistics engineering, we use systems engineering to design mobility systems. These are interdisciplinary systems. Like I have shown here, safety cannot be delivered only by engineers or only by medical personnel. We need to get the behavioral scientists to see how different people think. We need to address those issues. We need to look at the economic aspect and drive that in to ensure that economic justification is made in road safety interventions. We need to ensure that these programs are covered legally, that there is the proper policy at all levels, and governments, officers, agencies are held accountable and maybe even challenged in a court of law when they don't do what they're supposed to do. So professionals need to create these systems that are design these systems, the road systems, the medical emergency systems, the legal systems, and so on and so forth, so that the science behind it, the logic, the economic rationale is built into road safety intervention programs. The third area of professional responsibility is building competence. We are in an era where many competent people have left and are still leaving our country. And we need to constantly keep improving, retraining people who may be even less than competent to do these tasks. How much effort are we taking? How much effort and attention are agencies putting into developing their officers? And you can see in Sweden, in Australia, in Japan, how many different institutions there are for research, for lectures, for training programs, for webinars, to develop standards and guidelines, for workshops, develop designs. What do we have in Sri Lanka? We have nothing. And a lot of the officers that are covering road safety in government agencies, as far as I know, have not followed a formal course in road safety. Be road engineers, be the police, they get transferred from another area, and then they may go for a workshop or two. And once they begin to understand, they have either retired or got transferred out again. This is the way we are managing road safety. I believe even in a place like the RDA, I'm not sure how many of those few engineers that are there in the road safety unit have actually had a grounding in road safety. So it is up to professionals for us to persuade these organizations, offer programs, and so on to continuously train these people. So here is again a summary of responsibility of professionals from other countries. So here I have shown here what kind of professionals are involved, across these countries and some in those countries to bring about these safe systems. Road safety engineers, road safety auditors, injury epidemiologists, trauma surgeons, crash data scientists, road safety researchers, road risk assessors, EMS director, behavioral scientists, safety campaign program lead, ITS, infrastructure safety specialists, policy regulatory specialists, driver training curriculum people, safe systems specialists, safety economists. I don't think we have even one of these designations in Sri Lanka. We need to have lectures, study visits, diplomas like these countries had. And I believe those of you represent universities and associations like SLSTL, IESL, CILT, SLMA, so on and so forth, that are relevant stakeholders. I think you need to be doing more. It's not that it's a difficult, almost inappreciative environment, but we cannot give up. The zero fatality corridor, an expressway, where they're committed to bringing down the crashes to zero. That's a tough target. But like Vision Zero in Australia and in Sweden, that is their vision. Vietnam, Africa, Ethiopia, and Rwanda. So these are very encouraging signs, sometimes even one could say embarrassing to hear that such countries which do not have or had not had the resources that we have enjoyed for many years are taking this seriously when we have done pretty much very little. The third and final area I'm looking at in here, I will raise four points, is institutional or agency responsibility. First thing is that agencies must be responsibility to provide users with safe infrastructure. Agencies are responsible to design infrastructure for human error, not to turn around and say the driver drove too fast. And in here, I believe the aviation industry offers us many examples of how they build safe infrastructure, safe systems. They, in fact, make safety first their priority. They also design systems to prevent a single mistake from causing a catastrophe. That is why, as I mentioned, there is a pilot flying and a pilot monitoring. So no single action of a pilot can lead to a problem, right? And we know that, aviation has improved in its safety record tremendously, and it's today one of the safest modes of transport. And road transport has not picked up on many of those important interventions. And in roads, we actually just blame individuals instead of actually focusing attention on the infrastructure that contributes to accidents. How many of our roads have intersections that are poorly designed, not visible? Lane markings that are absent or inconsistent or disappear suddenly or appear suddenly. Pedestrian crossings that are not fully marked or visible. Lighting deficiencies. And in Sri Lanka, many drivers have got used to driving under such conditions. A road should be a means of communicating to the driver. The agency must actually be communicating to the driver how to drive. The lane discipline, come to a bend, reduce your speed. You're warned before an intersection. You're warned before a pedestrian. For us, we don't have the safety approach. We only plant a road sign or draw a line on the road and we expect the job to be done. And the police are happy to go and see whether the white line is crossed or something is done, and they're happy to take your fine and keep doing the same. Now, many countries, the legal system is now considering the role of these agencies as a public duty. And they're opening the door to what we call public litigation or public interest litigation. And countries like India and South Africa, we have had cases where road users have petitioned the courts to get compensation from road agencies, other transportation agencies for losses they have suffered and succeeded. In fact, I have been telling the media that maybe it's time in Sri Lanka that we need to, hold these government agencies more accountable to provide safe infrastructure rather than always blaming the driver. After each major crash, we hear of reports committees being appointed. We hardly hear of the reports. But even when the report is published, very often, none of the agencies that are responsible to provide safe infrastructure, to test the quality of the vehicles, test the competency of the driver are ever even mentioned, leave alone interviewed or even prosecuted. Some years ago, we saw a bus go down in Badula district, and very clearly we knew that there was a culpability on the road agency. But I don't think they even called it as a witness. So these must change. The second area is to introduce independent investigations. And in the aviation sector, we know that every accident, you have the legal investigation, then you have another parallel independent investigation only for the purpose of finding what they call no blame investigations, what went wrong, and how can we prevent this from happening again. That's all. In fact, in Institution of Engineers, Engineer Priyal De Silva is here, the committee, I believe, we went and spoke even to the President's Secretariat, isn't it? To offer the IESL to do such crashes, and that was before the spate of crashes about 5 months ago, and I believe we didn't even have a response to that. So I believe there's much to be done, and agencies must be open for this kind of intervention if we are to actually create better infrastructure. Also, databases and analysis. Unfortunately, in this country, many people find it very difficult to get data. Data is a key to systematic analysis and to help agencies to deal with causes of accidents. And these are rich sources, resources that must be actually given to institutions like the universities and researchers encouraged, not for the researchers to go begging and pleading to give data. And I think that culture about data must change. The culture about analysis must change. In fact, government agencies must promote the culture of research every year, asking what are the 5 things that we need to do to prevent accidents from happening. The third area is, of course, effective user training and enforcement. And very often road safety has been treated as a matter of discipline. Improve road discipline, improve law enforcement. But we hardly do a scientific approach to treat it as a multidisciplinary, evidence-based field of inquiry. And it's time that Sri Lanka shifted gears from ad hoc, accident-based, emotion-driven approaches, politically led approaches into fixers. We need to create this different paradigm of responsibility where agencies actually become effective in providing training and enforcement. We know, again, going back to aviation, how much training certification there is in that service. Okay, for the slightest thing, you have to go back and get retrained. And what do? Right? There's so much to be done here in this. And then finally, the institutional responsibility for post-crash care. Now, I believe, and I would invite researchers here to study this to see what caused this 2017 downward trend. As I mentioned, the continuation beyond 2019 probably was due to extraneous factors, but I believe that the Suez area emergency must have played a part. And I think we need to learn from good interventions and support these organizations and be encouraged that interventions can save lives. I believe in Sri Lanka, we have almost given up. Kerala vedanne, Kiyala vedanne. And I think if we do that, we will only have what we've had before, continuing this line going up and up. And with the economy picking up, with vehicle imports being allowed again, I think we have all the reason to believe that this curve is set to climb again. So back to my proposed table of responsibility, we can call it a table of accountability, so that we now look at a different paradigm of responding to government, responding to road safety by proving the way the whole society is set up to do that. So thank you for attending. I think we can now open the question, open it for answering these questions. And so please, we have people here physically. You can start off with some questions, and please put in your comments, questions that will be passed on to me to answer them. And maybe we can take another 5 minutes or 10 minutes for that purpose.
Thank you very much, Professor, for that very enlightening lecture. My question is this, with regard to post-care crash. Now, there are, you mentioned about people being very emotional. So at an accident site, immediately people go and try to rescue people, the victims. Sometimes they sort of, when they rescue, they make matters worse. Right now, in certain other countries, they don't allow such people to go. They have professionals who come and rescue the people. And there are instances where, if supposing somebody outside comes and does something, and suppose something goes wrong, they are actually penalized. So now I think many people have come into various difficulties, like, being disabled for life, or being dying because of, rescue by unprofessional people. So how can we sort of avoid this kind of thing? Thank you.
Thank you for that question from Engineer Priyal De Silva. Yeah, so I think this is the safety culture we need to create. And Sri Lankans are very helpful. And there are countries where people look the other way and go. And I think we need to be grateful that in our country, well, most people don't do that. They will go and do whatever they can. Even a three-wheeler will take them to the hospital, and people will carry them on their shoulders. And that's a good spirit. And I think we must not stop it. But I think this is where we need to educate people, to what to do when they arrive at a situation like that, how to help without actually hurting the cause. And that's where professionals need to come and say, good, you're going. Because otherwise you don't want the other thing to say, okay, we just, okay, now not my business. It's up to, Suasarya to come and help. I think that also is not the best approach. So we need to actually involve people, not only in post-crash, but pre-crash. I mean, people reporting problems on the road, people reporting, bad driving or bad enforcement or lack of enforcement. People need to be constantly aware of the safety requirements that are not attended to. I think again, people have given up. People have given up saying again, no point. And I think government needs to assure that such suggestions, complaints will be taken note of. Very often agencies will say, we don't have the people, we don't have a budget. And that is true. So this is where government budget helps, capacity building helps. And that's why government needs to provide that in order for this whole cycle of safety to work. We also have a question, says, to what extent is increased drug usage among drivers contributing to accidents in recent times? So as I said, I am not looking at the analysis of different causes in this. I'm looking at the macro, the bird's eye view of why, this is continuing. We know drunk driving was and is still an issue. Now, drug use and driving has come in. And so from time to time, we will have new problems coming up. And we need to be preemptive. We need to have the means to address these. And again, I think I would like to say we need to take a systematic look at, people preventing that happening rather than, testing and, all of that. For example, when a bus goes down the precipice, we tell, the bus driver is at fault. He's very young and, but then when the bus is designed to be the atmosphere of a nightclub and people are singing with intoxicated people, the driver need not be having taken drinks. Just the environment can actually put him off and make him less attentive. So the users, I think even in smaller vehicles, I have observed people are not conscious of the environment that a driver needs to concentrate. So whether you talk to the driver, whether you have music that is distracting, conversations that are upsetting the driver, all of these. So we need to have that higher sense of awareness, not only the drivers, but anybody who is on the highway. We also have a question, do we have access to analytical annual audit reports of RTAs and how can we get it? Must be RTI, right? Right to information. Audits, yes. So this is one area where standards need to be maintained. And many countries require the road agencies to audit their infrastructure every year or every 5 years. No new design, even at design level, the design is audited before it goes to construction. Now, I believe we've been talking about audit, and I think the RDA, I know, has been talking about implementing audit, but I'm not sure whether it has happened as yet. So safety is always pushed down. It's to be done. It doesn't get the priority that a road project gets to open, a bridge project gets to open it by a prominent person. And I think we need to change that going ahead. So we have another question. Is that the statistic in the regional fatalities for accidents where the GOSL do not consider this as a major loss to the economy? Yes, so if you take accidents in the region, we are in a good company. Many other countries have similar fatality rates as ours. That is no reason for us to stay in that same place. I mean, we need to be encouraged. We are development oriented. We are always looking to countries that have done better than us, whether it's technology or economy or education or health, and not looking at others who are worse and saying we are okay. So why should road safety be different? Let's look at the countries that have gone ahead. And as I said, some countries with a similar GDP as ours or per capita income are doing things now. Let's learn from them. Even if we don't have the economic strength of developed countries. So Sri Lanka is way behind we compare to some countries that have gone before. And we can show a difference if you want to. The next question says, what kind of relationship safety has with integrated public transport systems, which reduce the stress on drivers, passengers on roads? So as I said, I'm talking about a macro picture, and let's look at this macro. Everybody's focused on buses, minor things, and I think let's this holistically. Let's look at the big picture. Let's look at policies, programs, funding, accountability. And I think too often we have focused, even as professionals, smaller aspects, and that has not been enough. When the defined, not properly funded, whatever we do has very limited impact. And we saw maybe some good things happen, but they are not. Parameters just overshadow those continuous. So yes, we need improvements in bus passenger transport. We need to improve our road designs, our police enforcement, our technology, our rules. But I think the problem is not there itself. It's the bigger picture, the social attitude, the value that we place, the lack of government leadership and funding, probably professionals who seem to have given up now, who seem to prefer to work on the advancement of their careers rather than wanting to tackle a social problem. Agencies that have got carried away doing, other things rather than actually priority to safety. The next question is, how about education the road via media? Don't see the education being absolute. And that is why I say it is not the media, it is the professionals who must push the media to do this. It is the duty of professionals to come up with, with programs that have professionally, content of scientific value, medical programs like the question that was asked, how to help if you see an accident victim, and so on and so forth. So I believe a lot of this needs to be done, as I mentioned. But I think it's the professionals that need to do this. And obviously, government can help by inviting professionals, by providing money for media and so on and so forth, as it is done in other countries. Do you feel our motor vehicles licensing system has to go through more strict training, dedicated tracks for driver training? Absolutely. Our programs, I think, are at least 30, 40, maybe even 50 years old. There's no technology in testing. The curriculum is, I don't know, archaic. The testing procedure, I think, is embarrassing. The training process is equally bad, right? And I think that has to go through a complete overhaul. But again, I want to say these are not the only problem. These are part of a whole systematic issue. So we need to look at the problem as an epidemic and treat all the areas in a systematic manner. Yes.
Good evening, Professor. This is Yasit from INSEE. Thank you for selecting this topic where we have gone through many accidents in the country. So, if we consider the from our company perspective, so investing on maybe road safety and the maybe vehicle checking, maybe the driver training, and when consider all the investment, even though we expend some millions, the return is huge. Like when one accident happen, it is not only the cost of that what they considered during that period. Let's say if repair get 2 weeks, 3 weeks, so the opportunity loss during that period, the number of trips what we lost, and maybe the deliveries what we lost, and also the next thing is if we consider even the insurance cost premium going up, and in other hand, if you are driving past sometime, our fuel consumption is much more higher than, because some trucks, vehicles with go with the load, when they operating with a high speed, still the cost is going up. So all in all, so safety is not a cost actually. If you consider organization perspective, it is even in addition to the threat into the life, but in addition to that, cost wise also in the medium run or the long run, it is much more worth to invest for that. It is an investment actually.
Thank you, Yasid. Thank you for speaking. I am aware of some good work that was done, and I think that needs to be replicated. What your company did, I think that story needs to be retold. And as you're saying, yes, there is financial gain in the long term when you pay attention to safety. In economic sense, Sri Lanka, they say, is losing annually 1 to 3% of our GDP due to road safety. Those are the numbers, right? And if you take even 1% of the GDP, that is 300 billion rupees. 300 billion allocation that the government gives to the RDA, the entire. Do nothing significant about improving safety. I did the calculation. If we could save 1% of the GDP for the last 40 years, Sri Lanka's per capita income would have been double. Okay. So these are things that we need to highlight to decision makers, to the treasury, to the cabinet. Sometimes we think these are like CSR, charity works. Well, beyond that, even industry will find it actually pays in the long term to improve safety. Thank you, Zasif. How can the attitudes of daily habits of Sri Lankan public be changed to make road safety a shared community? Yes, absolutely. I don't think, as you said, is more than a legal requirement. This is, to me, the biggest problem. And this is where I think government needs to lead. Government needs to provide the leadership. That is what has happened in countries. And professionals need to actually respond to that and tell how. It's a long journey. No one program, probably no one leader can achieve it to the end, but one leader can start. And I think that's what we need to push for. Has anyone tested any program in integrating learning to do CPR as part of obtaining driving licenses? I don't know, Rob. I don't think we have, made any CPR requirement. Maybe there are institutions, drivers that are trained. Maybe some of the multinational companies might be doing that as part of their internal driver training. Yes, all good practices that can go in. Has anyone tested, do you think technologies such as cameras and sensors or strategic locations could help in the enforcement of road rules? Absolutely. There is so much technology, IoT, and even AI today that can be used to supplement. But again, these are, just technologies or devices alone are not going to deliver the result. They need to be set up in a scientific framework to identify what you're doing and to deliver real results. And too often we hear of people saying, I'm going to put GPS on my vehicle, I'm going to use AI, I'm going to put cameras and sensors. But if they're not connected to a system that delivers safety in the long term, that is just a showpiece. And I think we need to be aware that technology itself, however modern, if it's not connected to the overall system, is not going to deliver what we expect. How can that? Yeah, I think we covered all of this. Are there more? Yeah. So I believe we've expended the time probably a little more. Thank you for listening. It's always a privilege to find people who would listen to things that are close to my heart. Road safety is one, but perhaps we can do something more than just listening. We can maybe begin to do something more than that, of doing something. Thank you.